Retractorless surgery is possible, but the road has been long. This is a brief history of brain, spinal cord, and nerve root retraction. Professor Ramurthy's early set of lighted retractors and brain spatulas can be seen in the Neurosurgery Museum at PGS. Holding the retractor for hours with numb hands was blind and uncontrolled. This led to trauma and poor surgical results. Ancient Indian surgery was far advanced and ahead of nearly all the schools of surgery, and this lead was maintained for years. The timeline of this road to retraction could be divided into a road where extradural trepanation era can be said. Then intradural confidence grew, and then you had intradural brain resection era, where brain was resected to reach deep parts of brain. Then the intradural brain retraction era. Then the handheld retraction era. The mechanical retraction era, which was probably championed by Yasargil, and the minimal retraction era of Bernesky, Fukushima, Zhou, and a host of other surgeons. The no retractor or retractorless surgery era, I would place it to Spätzle and to Salim Abdul Rauf. The ancient surgical instruments of the Hindus were comprehensive. This is a remarkable book which was published in 1913 and won an award for that, which compares the comprehensive list of instruments. So this volume is the most detailed catalog of ancient instruments. There were sharp instruments, blunt instruments, tubular instruments, special instruments to hold tissue for inspection within cavity have been described. This gentleman wrote a monograph on depressed fractures, and in this he mentions and shows a diagram of a retractor. So names like Fraser, Heidenheim, Frazier were early designers of the retractor, which were basically metal spatulas twisted around. The finger dissection era was an era where the surgeons, even as brilliant and dexterous as Dandy, would use the finger to function as a dissector. But it was mostly an era of brain resection, where the brain was resected. Like, for example, this as an approach to a colloid cyst of the third ventricle as shown, and look at the amount of resection which is there. So the handheld retractors were by Alex Fraser, and Rickman Godley described in his first brain resection the use of a spatula. But it was this brilliant Horsley, Victor Horsley, was not only discussing brain retractors, devising brain retractors, but he also was talking about retraction techniques and retraction injury. The most important thing that he took exception to the fact that he felt that the cerebellum or the brain should not be excised, but retraction was favored by him, although he definitely made a point that retraction caused injuries. For years, we used to hold these retractors for the anterior cervical approach, and we never knew that this great Langenbach was the father of the surgical residency and was the teacher of Coker and Cushing in that line. The Wheatlaner's retractors were devised because he did not have surgical assistants, and so when he had to operate, he started using. So this is a remarkable person whose retractors have been modified quite recently means about 30 or 40 years back by the great Janetta. Keene used to use spoons, the front and the back of the spoons. Frazier, as you can see, this is Frazier operating with his assistant. Cross, Hamby had a retractor attached to the skull. You had Coker, and Coker's retractors bear the name of Coker, Cushing, because both of them sort of worked to retract veins and the nerves, and these nerves and vein retractors. Lighted retractors were by Adson, a very important pioneer. But the great Norman Dott, the English neurosurgeon, uh, was one of the pioneers of skull-based surgery, and this was a direct result to visualize brain without retracting. So you have this Gillingham taught retractors. Then came the massive push forward by Yasargil when he said that all neural tissue was eloquent and nothing can be retracted. And he developed this Lila retractors in 1968, and Ascalap and Yasargil had invented a better mousetrap. This transformed neurosurgery, this to transform the thing. And this was it is from this book where he is scolding Vinco Dolenk. Oh, sure, sure, just go right ahead. Don't worry about my patient brain. Rip it to pieces. Just do your precious operation. Forget about my poor patient. Her brain is obviously of no importance to you. Obviously, he didn't mean it. The Wheatliner's retractor was modified by Janetta, which you can see him operating. And the Sugita frame then appeared and transformed things. Then the series of retractors like Greenberg. Then what happened was that everybody started realizing that despite these retractors which were fixed, retraction injury was common. The pressure under the retractors was huge. And this led to a huge number of studies leading to an era which would perhaps be characterized as retractorless neurosurgery. And he felt that this, Spetzler felt that the quiet revolution, retractorless surgery was a very achievable goal. And he was heavily influenced by Yasargil, whom he wanted to imitate. So this do no harm became very, very important. And as you can see, this is the retractor arms. This is Spetzler operating. And according to this brain retractor system, a better monitoring system was definitely needed to avoid injury. This retractorless surgery could be retracting the tumor itself, as Professor Narayanan, one of my teachers, who was a direct student of Sir Wiley McKissick, used to say. He used to attach stitches to the tumor and cause retraction. So as this quiet revolution has slowly made major changes and has sort of reduced the need for retraction. And this is one of my large acoustic done about many years back. I think it about 20 years back. No, it is in 2009, about 11 years back, where this entire tumor was resected without any retractor whatsoever. So this is the long road, and thank you for your attention.